Hey guys, Dr. Mike Hansen here, and Happy New Year. Welcome to 2022, where this is my first video of the new year. And in this one, I'm going to talk about how Omicron is on the rise. Even though it does cause milder infection, it's probably going to lead to more hospitalizations. But the good news is that it could actually, in the long term, spell the end of the pandemic. The good news with Omicron is that there have been several studies showing that it does cause milder infection compared to Delta. Now, on the flip side, Omicron is the most contagious variant we have so far. It is super contagious. In fact, as of today, it's already making up 95% of new COVID cases. A study from Hong Kong found that Omicron replicates 70 times faster in human airways, but infections in the lungs was less severe. If you have a new variant that causes milder infection but is way more contagious, will that result in more hospitalizations? Most likely, depending on how well you control the virus. Recently, the CDC did update its guidelines for COVID-19 isolation period, shortening it from 10 days to 5 days if you're not having symptoms. This is because viral transmission is more likely to occur within those first 5 days of symptoms compared to those second half of those 5 days. So days 6 through 10, you're much less likely to spread that virus. This is how the virus eventually causes some people to end up in the hospital because it flies under the radar within those first 5 days of infection. COVID hospitalizations reached a record high of more than 142,000. That was about a year ago. Then it went over 100,000 back in September, and now we're looking at the same thing right now. At the same time, you have less available healthcare workers to take care of these COVID patients. One, because they themselves get COVID, and two, because lots of healthcare workers are quitting due to COVID burnout, which is at an all-time high. So you have more and more ER visits and hospitalizations with less staff available, not a good combination. Also, there's a concern that when it comes to toddlers, Omicron infection might resemble croup as more of an upper airway disease, or possibly resemble RSV, respiratory syncytial virus. So RSV infection causes bronchiolitis, meaning inflammation of the small airways of the lungs. So remember, toddlers and small children are not simply miniaturized versions of adults. They actually have unique anatomy and they present different challenges and different circumstances that can lead them to getting hospitalized. Now to some good news. Omicron infection might actually lead to protection from the Delta variant. And if that is the case, because Omicron is now the dominant strain, that could mean that this pandemic might start to fade away. This is based on a recent, yet to be published, yet to be peer-reviewed study that was done in South Africa. This was at the Africa Health Research Institute, in which researchers they took blood samples from 13 people who were, at the time, infected with Omicron, and all of them had symptoms. The researchers then took the antibodies from those blood samples, put them in a test tube, and then mixed them with different COVID variants, including Delta and Omicron. This is called a neutralization test. So 7 of the 13 people in the study were previously vaccinated, while 6 were not. The researchers then repeated this process 2 weeks after their initial infection. The results showed something expected and then something not expected. What was expected was the antibody response to Omicron. The antibodies neutralized Omicron in the test tube 14-fold at that 2-week mark. What was unexpected was that the participants developed some enhanced immunity against the Delta variant, with Delta neutralization increasing 4-fold. The researchers also showed that those who were previously vaccinated were able to mount a better neutralizing response against Delta, while the response in unvaccinated participants was more variable. Was this a perfect study? No, there was 3 main issues with it. One is that there's only 13 people in it. 2 is that of those 13 people, they didn't know who had previous COVID infection. And 3, this study only looked at antibody neutralization, which only tells part of the story when it comes to the body's immune defense. It's quite possible that Omicron infections simply amplified the existing immunity in the volunteers in this study, provided either by vaccinations or previous infections. If that is the case, then it remains to be seen what will happen to unvaccinated people who get COVID for the first time with this Omicron variant. But if further experiments confirm the findings in this study, that could mean that this pandemic will fade away. In the short term, especially in January and February, Omicron is going to put a huge strain on economies and healthcare systems. But in the long term, an Omicron-dominated world might significantly lower the amount of hospitalizations and deaths, especially as Delta is being pushed out. Omicron has been able to infect vaccinated people and those who've gotten sick with earlier variants. Just last month in December, researchers confirmed Omicron's capacity to escape antibodies that were generated from either previous vaccines or from previous infections. Antibodies that were very potent against Delta performed poorly against Omicron. This partially explained why so many vaccinated and previously infected people were getting infected with Omicron. So let's just assume for a second, hypothetically speaking, that this Omicron variant, it spreads, it runs rampant throughout everywhere, and causes mild infections in both vaccinated and unvaccinated people. That would mean that people who get infected with Delta will have a smaller likelihood of passing along the virus to others, while at the same time, Omicron will more easily infect those who've recovered from Delta. That competitive edge could, in effect, wipe out Delta. But even if Omicron does eliminate Delta, that doesn't necessarily mean that Omicron will stay on top forever. Once people gain immunity to Omicron, natural selection will favor mutations that produce a new variant that can escape the immune system. So we're likely looking at one of three scenarios moving forward. One, COVID starts looking more and more like the seasonal flu, where you have one dominant strain taking over every year. Two, COVID looks something like dengue fever, where you have several variants circulating the globe, causing some people to become ill here and there. And then third is the best case scenario, but is also the least likely, in that Omicron becomes the king of variants, but eventually herd immunity eradicates this virus altogether. That's going to be all for this video. Again, Happy New Year, stay safe and healthy, and I'll catch you in the next one.